Hi, I'm Sam King, a board-certified personal injury attorney. Today I want to share some important information about the types of complications that can occur after a burn injury. The first type of complication I want to address is infection. When the skin is severely damaged or dead, or if a burn is left open and exposed, the body is more vulnerable to airborne pathogens like bacteria and fungus. Prompt care and attention of burns is critical to avoiding the risk of infection. It is all too common that I see infections in burn cases, and the consequences of them are often severe. Many of them lead to life-threatening illness, extended hospitalizations, loss of limbs, and horrible scarring. The most severe infections can lead to sepsis, which if left untreated can lead to organ failure and even death. In addition to being at risk for infections, burn victims are also at risk for a variety of blood complications. Patients with excessive blood vessel damage from burns may develop what is called hypovolemia, or low blood volume. When this happens, the body can go into shock and multi-organ failure. Unfortunately, the condition is very hard to treat. Patients who suffer severe burns are also more susceptible to developing blood clots in the limbs. This occurs due to the overall shock that burns cause to the body and to extended periods of bed rest required for burn recovery. The longer a patient is bedridden, the higher the risk of developing blood clots. It is important to mention that patients may experience physical and psychological complications even well after the burn injury is initially treated and managed. For example, the most common is scarring. Burn scarring occurs in virtually all burn cases that are severe enough to require medical treatment. In third and fourth degree burns, scarring may be severe and lifelong. In cases where the burn injury occurs over joints, the patient may experience joint mobility problems and stiffness. This occurs when healing skin contracts or pulls together. As a result, the patient has a limited range of motion in the affected area. Please call me if you have any additional questions about burn accidents or injuries. Throughout my career, I've worked with many burn victims and their families, and I'd be happy to answer your questions. Also, for more information about burns and your legal rights, please visit my website at www.burninjuryguide.com. Thank you very much.